You could be doing everything right, eating clean, exercising regularly, even taking your medication, and still, your blood pressure just won't budge. Why? There's one hidden cause of high blood pressure that millions of people have, and most don't even know it. It's something that can silently damage your heart, your brain, and your kidneys, and it's not what you think. Do you wake up tired even after a full night of sleep? Do you snore? Do you feel foggy or groggy throughout the day? These aren't just annoyances, they could be red flags for something much more serious. High blood pressure or hypertension is often called the silent killer because it damages your body quietly, without noticeable symptoms until it's too late. It increases your risk of heart attack, stroke, kidney failure, and even dementia. Now, here's the part most people miss. Studies show that nearly 30 to 50% of people with resistant hypertension, meaning high blood pressure that doesn't respond well to treatment, have one thing in common. And yet, most doctors don't even screen for it unless they're specifically looking. So what is it? In this video, I'm going to explain the #1 hidden cause of high blood pressure, one that's underdiagnosed, often ignored, and fully treatable. I'll show you how it affects your body, how to know if you might have it, and what you can do starting today to protect yourself. I'll also share real patient stories that show how powerful it can be to finally address this issue. So, what's the hidden cause? The answer is sleep apnea. That's right, the condition where your breathing repeatedly stops and starts while you sleep. And it's a lot more common than most people think. Sleep apnea occurs when the muscles in your throat relax too much during sleep, blocking your airway. Your brain senses the drop in oxygen and wakes you up just enough to start breathing again. This can happen dozens or even hundreds of times per night. The problem is, you often don't remember it. It's like someone tapping you awake over and over, all night long. No wonder you wake up exhausted, even after 8 hours in bed. So, how does this lead to high blood pressure? Every time your breathing stops, your oxygen drops, your brain panics, and triggers a surge of stress hormones, like adrenaline and cortisol. These hormones constrict your blood vessels, raise your heart rate, and signal your kidneys to hold on to salt and water. This creates the perfect storm for elevated blood pressure. And when this cycle repeats night after night, it turns into chronic resistant hypertension even if you're eating right and exercising. Now, who's at risk? You might think sleep apnea only affects people who are overweight, older, or have large necks. While those are certainly risk factors, I've seen marathon runners with sleep apnea. It doesn't discriminate. If you're wondering whether you could be at risk, here are a few signs and symptoms to look out for. Loud snoring, waking up, gasping or choking, dry mouth or sore throat in the morning, headaches upon waking, extreme fatigue during the day, poor focus or memory, and of course high blood pressure that's tough to control. You don't need all of these to be concerned. Just one or two might be enough to warrant a closer look. Let me tell you about a patient of mine. We'll call him Mike. Mike was 47, fit, and took 3 different medications for blood pressure. He did everything right, but his readings still hovered around 160/100ths. He didn't think he had sleep issues. He never felt like he woke up at night. But his wife said he snored so loudly she had to sleep in another room. We sent him for a sleep study, and sure enough, he had severe obstructive sleep apnea. After starting treatment with a CPAP machine, his blood pressure dropped to normal in about 6 weeks with no new medications added. That's the power of treating the root cause. So how do you know if you have sleep apnea? There's a simple screening tool I use in practice called the Stop Bang Questionnaire. Ask yourself these 8 questions. Do you snore loudly? Do you often feel tired during the day? Has anyone observed you stop breathing during sleep? Do you have high blood pressure? Are you over 50 years old? Is your neck circumference over 17 inches for men or 16 inches for women? Are you overweight or obese? Are you male? If you answered yes to 3 or more of these, you may have a high risk of sleep apnea. Talk to your doctor about getting a sleep study. They're much easier to do now, with many options available from the comfort of your home. Now, let's talk solutions, because the good news is, sleep apnea is treatable. The most effective treatment is a CPAP machine, which stands for Continuous Positive Airway Pressure. It keeps your airway open throughout the night. It's not glamorous, but it works. Other treatments include weight loss. Even a 10% reduction in body weight can dramatically improve symptoms. Oral appliances, made by dentists, can help reposition the jaw and keep the airway open in mild to moderate cases. There are also positional therapies and, in rare cases, surgery if nothing else works. As a doctor, I can't tell you how many patients I've seen where treating sleep apnea was the missing puzzle piece. It's something we should be screening for more often. Journals like The Lancet and JAMA have published research confirming that treating sleep apnea not only improves blood pressure, but also reduces your risk of heart disease, stroke, and even early death. This isn't fringe medicine, it's real, science-backed, and life-changing. If you found this helpful, especially if you heard something that made you think, wait, that might be me, please give this video a like and share it with someone you care about. We post weekly videos on topics that matter to your long-term health, so hit subscribe if you want to stay one step ahead of silent health issues like this one. And if you're curious about other early signs of heart disease, check out the video linked here on the screen. It's full of things most people overlook. Let me leave you with this. Sleep apnea isn't just a snoring issue. It's a heart issue, a brain issue, and a blood pressure issue. If your blood pressure isn't responding to lifestyle changes or medication, don't just blame stress or salt. It might be your sleep. Early detection and treatment can literally save your life. So tonight, when you go to bed, pay attention. Your body might be trying to tell you something. Stay well, sleep deeply, and take care of that heart of yours.